So we do need to be aware of the categories of diagnostic information. So number one, what is the difference between subjective, hybrid, and objective evidence? You definitely need to know the difference because number one, it says you're an authority, but also it's one of the common defense arguments with a soft tissue injury is there's no objective evidence. So you come across as being an authority, but also it when you know this and you deliver it, especially in a trial testimony, it shows that you are really an authority and you know what you're doing when you're talking about evidence. So obviously, subjective evidence is what the patient says on their own. So that's the least trustworthy evidence, is what the patient says. And then the second evidence is the hybrid evidence. That's when most doctors join my documentation, that's what they don't know and they haven't heard of. And hybrid evidence is a combination of the patient's actions or reactions and the doctor's interpretation. In other words, it takes two people to make that determination, the patient and the doctor. That's hybrid evidence. Now, you're going to see that most of what you think is objective evidence is not. Reflexes are not objective evidence. Dermatomes are not objective. So we'll go through these and go, okay, a lot of these things you think are objective, they're not. They're hybrid. And why is that important? It's important not just because of the reasons I told you, but it depends on the experience of the art of being a doctor. So the doctor is it's the science of being the doctor and the art. Well, this is where guys that have been practicing 20, 30 years, 40 years, they're really good at the art. They're good at, I mean, some of these old guys, I mean, they're just so good with the exam. They can touch the patient, feel the patient. They know what to do. It just comes so much easier from experience. And yet some of the new guys out of school, they can't even do an orthopedic test properly, ergonomically. Well, that's the art of being a doctor. Okay. And then there's the objective evidence, which is the most important. So obviously, out of all the evidence, you need to pay a lot of attention to the objective evidence. That's like the anchor of all evidences. Okay.